The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone. Welcome to Fight Back Forward, a webinar brought to you by the Partnership for Food Safety Education. This is Ashley Bell speaking, your BFF or backfighter friend. I'm just going to give you a brief introduction to the event before I hand it off to today's presenters. Today, we will cover the successes of the Consumer Food Safety Education Conference, results of the 2014 environmental scan of consumer food safety education efforts, preview a comprehensive food safety education assessment now underway, and talk about some next steps around measurement and evaluation that you guys can take. So let's meet today's speakers. First up, we have Shelley Feist, who you all probably know. She is Executive Director of the Partnership for Food Safety Education. Our next presenters have some longer titles. Our first is Sharmi Das. She is the Director of the Division of Education, Outreach and Information, Office of Analytics and Outreach for FDA's Center for Food Safety and Applied Nutrition. Next, we'll have Dr. Patricia Baruso, an ORIAS Fellow. She also works in the Division of Education, Outreach and Information, Office of Analytics and Outreach, FDA, Center for Food Safety and Applied Nutrition. So before we get into what we're going to talk about today, we just wanted to let you know, in case you hadn't heard, that the World Health Organization has selected food safety for their topic for World Health Day 2015. We want to show the world what backfighters do for food safety every day. So we will be asking you for stories, photos, and answers to some questions. On the 17th, this Tuesday, you will get an email from us, as long as you're subscribed to our email list, that will tell you exactly what we're looking for. So start thinking about some things you might want to share for World Health Day 2015. So now Shelley Feist is going to go over some highlights from the Consumer Food Safety Education Conference.
Thank you, Ashley. Hello, this is Shelley Feist. I'm so glad that you have joined us today to talk about follow-up to the conference that was held in December. The Partnership for Food Safety Education is a nonprofit that focuses on three main areas. We convene experts inside and outside of government around consumer food safety messages and programming. We amplify the work of you, the backfighters, to tell the story of what public and private sector partners are doing in food safety education for consumers. And we lead in evaluation. And today's topic is really helping to provide more context around what's being done in consumer food safety education and what's being measured, what's not being measured. At the end of this webinar, there is a survey that we really would love you to take that's going to help give us even more information for the next webinar we will do for you. So again, convening's always been an important part of the Partnership for Food Safety Education's mission. It's a fundamental aspect and one of the impetuses for why the partnership was started in 1997. In December 4th and 5th, we had on-site attendance of more than 300 at the Consumer Food Safety Education Conference. There were 1,400 estimated that participated via live web broadcast. And I hope you were there. We had 15 student scholars who got full or partial scholarships, and they're shown here on this page in the upper right corner. This was the first conference since 2010, and we got a lot of great feedback. Very high proportions saying that the conference provided tools and knowledge that they needed to advance Healthy People 2020 food safety behavior change goals, that they also learned strategies they can apply to their work. Many saying they would make changes in their practice as a result of information that they got at the conference. And many saying they had pieces of information they would immediately disseminate to their colleagues coming from the conference. And then and then 100% of attendees saying they felt it was a great opportunity for networking. The partnership is committed to continuation of the conference, and we should have information for you in a few months about when the next conference will take place. In our commitment to support health and food safety educators, we wanted to provide as much information from the conference free for those who weren't able to attend and for those who were. So you'll find on this terrific page at teamfoodSafety.org/conference videos, including full videos of the plenary sessions and many, many of the presentations from both breakouts and plenary sessions. So there's plenty of information there for you to mine in your work. So today we'd like to start off here with a poll about what have you been working on since the conference. Have you taken action since the conference to plan your future work or to evaluate work? So this is planning and evaluation. Has some of that taken place since the conference on December 4th and 5th? So we'll leave this open for a minute, and we look forward to sharing the answers. Many of you haven't voted yet, so take a minute now to vote or to tell us yes or no on this poll. Okay, we're gonna close the poll, show you the responses. Looks like a good portion of people have had some time or have made it a priority in the last month or so. Trying to bring it up here to show you. Oh, okay, so hopefully you've seen it. A good proportion of people have spent some time working on planning work and on evaluation. So that's terrific. All right, thank you for that input. As I said at the beginning, we work to amplify and support the work of health and food safety educators. So it's very important that we learn as much as we can about who is involved with consumer food safety education. We commissioned an environmental scan that would really look at what are the leaders in this area in both public and private sectors doing to reach millions of American consumers. And we know that educators across these sectors are reaching millions. We commissioned a survey from North Carolina State. There hadn't really been a systematic collection of whom is providing what information to what audiences. And we feel that this data collection is a necessary step to a needs assessment that will help us better describe the current population of educators, of their programs, and their sources of information and materials. And there are gaps within food safety messages that we also have wanted to learn more about. Now in methods, this survey was designed to really give us sort of short stories or case studies from the different sectors. And again, this was entirely about consumer food safety education. SurveyMonkey was used, and participants were able to fill out information for up to 5 different food safety education programs. The survey was fielded in the summer, and then it was reopened briefly in the fall, so we could accommodate some groups that hadn't been able to participate in the first round. And kind of what we found, I'll just go over some very top-line context here of what came out of the survey, including that food safety educators, who make up 100% of all educators, come from different sectors, as we suspected. Many of you will hopefully find where you fit in these pieces of the puzzle. Academia and cooperative extension, of course, are very large and important and active sector as is public health, and then the federal government and a variety of nonprofits. These are nonprofits that aren't necessarily doing work in food safety, but in many cases are delivering health services, feeding programs, and other services for families. Next. This is, to me, a very interesting part of what's going on, and that is just the overwhelming majorities in different parts of the food safety educators' puzzles that are using face-to-face, in-person contact. This is really important information for us to know because it helps us figure out how to serve as educators. So as you see, it's extremely high numbers this scan found. In the next slide, you'll see also how many use online channels. This actually dropped somewhat. So again, the direct person-to-person is very dominant, but online remains, of course, important too. And then finally, in the next slide, television, a medium that reaches many, many people in their homes, is not used as much and is primarily used by the federal government. And then finally, there are other channels that are used by these various sectors, and this would include all kinds of mail, phone, displays, printed materials. As you can see here, public health kind of emerges on top, that these other channels work for public health. So as we move through today and get to Patricia's presentation, one of the important learnings from the environmental scan was about whether people are measuring their impacts of their consumer outreach programming. And what we found in this scan was that half were, and then the other half either were not or didn't know if they were. So we're hoping, and again in the quick email you'll get after this webinar, we're hoping to learn more from you about where you fall in this and what might be barriers for you all in doing more measurement and evaluation. So finally, other learnings from the scan include, of course, that the federal government reaches the most people on an annual basis. In part, this is due to their use of television. Children and households with children are primary targets for education efforts, and we need to look at ways to increase the engagement of the food, retail, and food industry, and to better capture this activity and get those industries to involved in things like our environmental scan. For more information on the scan, you can contact me, Shelley Feist, with the Partnership for Food Safety Education. Oops, it looks like our name dropped off the end. That's my fault. Or if you have any questions about National Consumer Food Safety Education work, please contact me. And now I'm very pleased to introduce Sharmi Das. She, as you can see in this presentation, we've worked together on this important work to understand more about this landscape. And Sharmi, thank you so much for being here today and for this work that you all are going to talk about today.
Thank you, Shelley. Good afternoon, and thank you again to everybody who's tuned in for giving us
and the supermarket industry at.
Hello. Hello.
Hello?
Hello, we hear you.
Okay, I thought I got disconnected.
Oh, no, you're there.
Okay. So good afternoon again, and thank you to Shelley and the partnership for giving us this opportunity to present to you all today. My name is Sharmi Das, and I'm the Director of the Division of Education, Outreach, and Information in FDA CIFSAN. I'm delighted to be able to introduce to you all the work done by Dr. Patricia Baruso, an ORISE fellow who's been with us since June of last year, and she's been working on a systematic review of food safety education programs and research. Next slide, please. So here's an outline of what we'll cover in the next 20 to 25 minutes. The reason for doing the systematic review, how it was done, what we've learned from the literature review, and share some of our preliminary recommendations based on noticeable gaps. And these are preliminary recommendations because Dr. Baruso will complete her review by April, when we'll have a comprehensive set of final recommendations to share with you all. Then I'll talk about our plans for sharing these recommendations as widely as possible so that we can get feedback and comments, and then start thinking about how we can jointly implement some of the proposed recommendations. At the end, we'll be happy to answer your questions. Next slide, please. So this slide summarizes the purpose of the project. And as you all have already heard from Shelley earlier, the environmental scan showed that many of us do food safety education. Government agencies, community-based organizations, state, local public health departments, cooperative extension, industry, etc. And we've all been involved in developing and implementing many programs in the last 10 to 15 years. And we also know that many of our programs were very successful. So this is not an evaluation of individual campaigns or initiatives, and I must also stress that this is not a quantitative assessment. What we wanted to know was the cumulative impact of all these efforts on consumer food safety and food handling practices. What are these areas where we've been able to move the needle and where we have to put in more effort? Based on this systematic review, we then would find the gaps and come up with recommendations for future food safety activities and initiatives. As we all know very well, resources are very limited and all of us have to prioritize. These recommendations, we hope, will enable us to find more opportunities to collaborate and find creative ways of working together on a particular food safety issue. In a nutshell, the purpose of this project is really to figure out how to optimize all kinds of food safety education strategies and try to set a path for future activities. Now I'll turn it over to Dr. Patricia Baruso to go over the next few slides and talk about her assessment.
Thank you, Sharmi. Next slide, please. So I just want to start off by talking about how important and sometimes difficult the process of food safety education can be. As we all know, pathogens can come into the home many different ways, from the environment, from foods, from other people and animals. For this reason, the consumers who prepare food at home play an important role in preventing foodborne illness, so much that they are often referred to as the final defense. Usually, when we think about the purpose of education, it's to mitigate these risks of illness by providing information to consumers, which we hope will influence their decision-making process. But we all know education alone is not sufficient to guarantee people will practice safe handling behaviors at home. From what we know about how people process information, it seems like it's almost never a straight shot from information to action. Instead, the ability of education messages and campaigns to influence consumer behavior depends on the success of many steps after initial exposure. I've listed a few here. In order for the message to be successful, the consumer must be exposed, believe the message applies to them, listen to the whole message, understand the message, agree with it, and finally, if we're lucky, act as the message suggests. And these are only a few steps. Factors such as self-efficacy, access to resources, and many others affect this process. What I'm trying to say is there's a lot to think about when crafting education programs and campaigns. Next slide, please. So I'll go right into describing the methods of the literature review, and I want to start out by emphasizing what Sharmi said, that the purpose of this project is a systematic review. It's not a meta-analysis, and I didn't really do any quantitative analysis. The goal is to qualitatively synthesize what we know about consumer food handling, what we've done to try and improve it, and what has been the cumulative impact of those efforts overall, and then provide some recommendations for how to move forward. It's not really about the impact of a single program or campaign, but rather identifying what strategies work or don't work in particular situations. So the review is ongoing. So far, I've reviewed about 109 research papers, including all different types of research: surveys, interviews, focus groups, observations. Tried to keep it from within the last 15 years, and most studies actually came from the last 10 years, and limited to studies from comparable countries, developed mostly English-speaking countries such as the United States, Canada, and the UK. The research included 3 categories. First, what do people know and what are people doing? Knowledge, attitudes, and behaviors related to food handling. Second was communication and behavior theory, looking at theoretical constructs such as risk perception, social norms, trying to figure out what people do, why people do what they do, and think about how this can be improved. And finally, the design, implementation, and outcomes of education campaigns. So how do these theories and strategies actually work in practice, and what has been done and what hasn't? And I want to say that I'm only today going to be talking about these first 2 categories, not discussing or evaluating individual campaigns. In addition to the literature review, I conducted in-depth interviews with food safety educators for kind of behind-the-scenes insight about program development and implementation, as well as ideas for future needs. Next slide, please. So I'm going to give a brief preliminary overview of the literature review. This is not a comprehensive list of results, but just kind of some overarching themes. So starting with knowledge, it seems most studies report high numbers, between 75 and 100% of consumers are knowledgeable about hand washing and also avoiding cross-contamination by properly cleaning or separating cutting boards and utensils. There's 2 caveats with this. First of all, when I say knowledge of how to wash their hands, I'm only talking about the use of soap and water, not including people who know how long to wash their hands or that they should dry them afterwards. And for knowledge of when to wash or clean cutting boards and utensils, it seems that consumers know in theory when to do this, but they don't always recognize every situation when it's necessary. For example, if you ask someone, should you wash your hands after you have contact with raw meat, they will say yes, but they may not also realize they should wash their hands after they touch raw meat packaging. The literature also shows that consumers still lack knowledge related to some other food safety topics, especially with regard to specific information. For example, many consumers know they should use a food thermometer when cooking meat. However, few can identify the correct internal temperatures of foods or know how to use a thermometer with small cuts of meat. Overall, it seems consumers have general knowledge about what to do, but don't always know the specifics. Next slide, please. So then moving on to behavior. Again, this is a brief preliminary overview of the review and not a comprehensive list of results. I'm presenting data from all the different studies as a range of results. For cross-contamination in the food thermometer use, I combine the results from observed and self-reported data because the results are actually pretty similar, within 10%. For refrigeration temperature, what you're seeing is only observed data, and for hand washing, I make the distinction between the 2. So starting off with high compliance with recommended behaviors. In general, it seems most of the studies agree that the majority, and in some studies, all consumers correctly clean or use separate cutting surfaces when cooking, which is great. And I recognize this isn't perfect compliance, but if these reports are showing that at most we have 40% of people doing this incorrectly, there's been significant progress, and that's not a bad starting point. For low compliance, it seems that there's still low compliance for a few behaviors, especially related to temperature control. In homes where refrigerator temperature is recorded, anywhere from 1/3 to 3/4 are too warm, and many consumers still do not use a food thermometer when cooking at home. Finally, there is conflicting reports from studies regarding some other behaviors. For example, hand washing self-report data tells a very different and more favorable story than the observation data. For hand washing, there also may be a difference according to the situation. Observed hand washing after contact with raw meat seems to be slightly higher than observed hand washing before meal preparation. Next slide, please. So to summarize those findings, it seems like we've had significant progress and improvements. And I didn't show any of the trends data here, but it's clear that consumer food handling practices have improved a great deal in the last 20 years. And this is really due to all the hard work and the cumulative effort by educators everywhere. But, and there's always a but, there is still work to be done, and figuring out how to continue to improve consumer food handling behavior can be challenging. So as educators, we need to think about how to improve and vary our approach to food safety education. Considering why individuals neglect food safety at home, there's many different internal and external factors that influence consumer decisions about how to handle food. And we should use that information to inform education campaigns. 20 years ago, it may have been really important, for example, to improve consumer knowledge. However, today we see many consumers have the necessary knowledge but still do things wrong. So we need to start to tackle other barriers that still exist. Next slide, please. So this is the first of two main sets of recommendations I'll be sharing today. It's directed at educators, anyone developing or implementing food safety programs. And it's do what works and stop doing what doesn't work, which sounds very simple and is not meant to be condescending. There's a few key things we can do to improve our efforts. The first, work at teachable moments. We know that people ignore messages that they don't believe pertains to them personally, so it's important to take advantage of attention when you have it. For example, many people pay attention to news coverage of major foodborne illness outbreaks or food recalls. While no one can predict the date of future outbreaks and recalls, we know they will occur. Educators can have materials ready related to safe handling of specific foods, say those that are often recalled, ahead of time. Doing this allows you to distribute these messages during and immediately after the recall when people are paying attention and the messages can have the greatest impact. The second bullet is to design campaigns based on needs emphasized by recent food safety research. We've made progress in some areas regarding food safety behavior. This doesn't mean these behaviors should be completely neglected, but when funds are limited, we need to consider what is the best use of time and resources. It's helpful to use a systematic approach to design campaigns that focus on factors that have the greatest influence on target behaviors. And I'll give an example of this systematic approach in a few minutes. The third bullet is about evaluation. The partnership's environmental scan says that only about 50% of respondents evaluate the impact of their education efforts and programs. You cannot overstate the importance of all types of evaluation. So I'll discuss a couple of examples of 3 types of evaluation. Formative evaluation before the program begins can help improve your ability to reach your target audience through better and more specific message framing and tailoring. And when we think of message framing and target audience, we often put people in boxes based on their age, their race, their education, etc. But it's so much more than that. Looking at values, cultural influences, and the needs of your audience can help to adjust the materials and messages. Second, process evaluation during the program implementation. This involves making sure the program is up to date and running smoothly, regularly checking to make sure materials and facilitators are up to date with the latest research. And finally, outcome evaluation after the program is complete. This tells you if the program accomplished what you want it to accomplish. And if there's no measurable effect, it doesn't mean that the program or the message was bad, but it can help you figure out what can be changed to improve the program. Without evaluating outcomes, you could be repeating the same mistakes over and over. Next slide, please. So I'm going to give an example of this systematic approach for designing need-based campaigns. So this comes from several communication theories which outline this approach for public health campaigns, and it's easily applied to consumer food safety research. Basically, the idea is we shouldn't be designing new campaigns to target a behavior or audience unless the literature demonstrates a specific need. Again, not saying to ignore areas where we've made progress, but to maximize available resources. The first step is to identify the target behavior and audience using information from the literature or other research. In this example, I'll be talking about correct hand washing using soap and water. And you can identify the audience here at the beginning or closer to the end of the process. In this example, I'll specify the target audience at the end. So I'm starting off broadly with all consumers who wash their hands incorrectly. Next slide, please. The second step is tracing backwards to assess the role of theoretical constructs, such as risk perception, motivation, awareness, and social norms, relative to the target behavior. Basically, you're asking which factors influence a person's decision to perform the behavior, and of those, which have the strongest influence on that decision. Think of this as mapping the target behavior. In this example, I'm listing a couple potential determinants in their relationship to hand washing. So first, starting with lack of knowledge, as I said before, several studies report the majority of consumers correctly identify the correct hand washing behavior, so it's probably not a big problem. Low risk perception. Talking about, does the individual believe this behavior is necessary to reduce their risk of illness? And if yes, do they also believe that the consequences of foodborne illness are severe enough that they should wash their hands? The research tells us that perceived severity of foodborne illness is often low, and perceived importance of hand washing varies significantly depending on the situation. Then moving on to lack of resources. This is the inability to purchase items necessary to practice safe food handling, in this case, soap. We see that between 8 and 35% of homes or kitchens don't have soap, and so this may be a problem for some people, especially for low-income audiences. And finally, lack of awareness. People may forget or just not recognize particular circumstances when a behavior is needed. And the need to perform certain behaviors is much more obvious if there are visual cues, such as visible dirt or grime in the case of hand washing. So after doing this, you should have a better idea of the main factors that impact the target behavior. In this example, it's probably not lack of knowledge, possibly lack of resources, depending on the population. More generally, perceived importance of hand washing, severity of foodborne illness, and awareness may have greater influence. Next slide, please. The third step, the last step, is about how to communicate your message. The approach should be based on key behavioral influences that you just identified, as well as audience preferences. This step is the other place where you can decide target audience if you didn't before. In this variation, the audience is informed by the literature. For example, we previously identified lack of resources may be a barrier to hand washing for low-income consumers. Based on that, you may want to design a campaign to address the needs of this subgroup. So I want to emphasize designing the campaign according to the audience's preferences. Here's where a formative evaluation is still important. Finding out everything about your audience. What are they like? Who do they trust? Where do they look for information? Those types of things. So I've listed a couple suggestions here, and they are informed by the literature, but I haven't tried any of them. Some of them would definitely not be well received by certain audiences. So if you're going to try these, you should test any messages first. This is just an example. So I picked 3 factors that I showed before, believed to have major influence on hand washing behavior, and came up with suggestions for campaigns to address each. For example, for the barrier of low-risk perception, people who underestimate the consequences and severity of foodborne illness, the suggestion would be to appeal to emotion, specifically fear, with stories about victims of foodborne illness. Next slide, please. So I'm going to switch gears now and talk about the second set of recommendations, which is for everyone. It's to form meaningful collaborations and partnerships. Again, this isn't meant to sound condescending. I'm sure we all recognize that we can't do this alone, but there is still a lot more we can do by working together. The first bullet is really for us working at the FDA and other agencies. We are often far removed from educators in the field, so to speak, who develop and implement these programs. We should be better at working with these organizations, learning from their experiences, and responding to their needs. That being said, we really encourage your feedback on this presentation. It's really easy for us to make these recommendations when we're not the ones who are doing it, but we really want to know what you think and what will work and what won't work. We have our emails at the end of the presentation. We really encourage you to get back to us with what you think. The second bullet is to encourage businesses to incentivize these behaviors. We should all take advantage of opportunities to collaborate with businesses and organizations that have other roles in the food industry. Many educators have extensive knowledge of and good relationships with local businesses, which can be utilized to encourage safer food handling behaviors through an environmental intervention. This has been done successfully in the past. For example, the Cook It Safe campaign, where agencies worked with industry leaders to improve microwave directions on frozen foods. But this type of intervention is currently underutilized. Some examples of what I'm talking about: working with the food industry or supermarkets to have sales or coupons on certain items, such as food thermometers. Working with local supermarkets to place food thermometers near the meat section or at checkout counters. Also working with kitchen designers and engineers. This can help develop products that make food safety easy, so to speak. This includes high-tech products, such as the automatic soap dispenser for homes, like you see in the picture, or simple solutions, such as color-coded cutting boards, red for meat and green for produce. Again, turning these suggestions into reality is not necessarily easy. It requires thinking outside the box and reaching beyond typical networks of partners to make connections. But this can exponentially increase the number of people we reach with our messages, and even make recommended behaviors more convenient for the average person. Next slide, please. And so I have a very simple conclusion about a pretty complex topic. The thing about consumer food handling behavior is it's not simple. It's influenced by many factors, internal and external. However, it's also not random. It may appear to be, but people usually have their reasons for doing what they do. Whether we as food safety professionals think those reasons are appropriate is another story, but people don't just randomly decide how to handle food. And the good news about behavior not being random means that it's predictable. And if it's predictable, then it can be improved. We just need to work on being better at knowing what predicts a given behavior. And now I'll turn it back to Charmaine to talk about our future plans.
Thank you, Tricia. So as Dr. Baruso mentioned, her assessment will be completed in April. This was really only a sneak peek at what's to come. But one key aspect of this project is to promote the results extensively, and we want to share the findings and the recommendations as broadly as possible with professionals who develop and implement health education programs, with academia who do research, with public health professionals who develop policy, with industry, and with all other stakeholders who have an interest in food safety. And as Tricia mentioned earlier, we really want to do this to receive feedback and comments. And remember that dissemination is just the first step. Implementing the recommendations is the ultimate goal here. So the final recommendations will be made with the intent to implement some at FDA and encourage adoption by other researchers and educators in the field. So as far as what we have planned for the next few months, in May and June of this year, we're scheduling presentations within FDA and reaching out to our sister agencies, CDC and USDA. We would love to present again to the partnership again, hopefully sometime in the fall. Shelley and Tricia are also presenting at the Food Safety Summit in April in Baltimore. And Tricia is also submitting abstracts to several national conferences like NACCHO, IAFT, and APHA. We'll also look for opportunities to publish in a peer-reviewed publication down the road. So if you all have any suggestions or ideas or would like Tricia, Dr. Baruso to present at your agency or organization, please feel free to email us. And don't forget to fill out the survey at the end of this webinar, something that Shelley mentioned earlier. So thank you, and I'll turn it over to Tricia.
I just wanted to say thank you to everyone for your attention today, and especially acknowledge and thank the people at FDA who have given me so much support and guidance on this project: Charmy Das, Amy Lando, Marjorie Davidson, and Alan Levy. And as well acknowledge and thank the interviewees: Howard Seltzer, Louise Dickerson, and Marjorie Davidson at CIFSAN, Maria Malagon from the USDA, Christine Prue from the CDC, and Shelley Feist from the partnership. Next slide, please. And this is mine and Charmy's emails. If you have any comments or suggestions, we would really be interested to hear them. Thank you.
All right, thank you both for that. One final slide before we start taking your questions. You can go ahead and start submitting questions as you have them. We just wanted to draw your attention to a webpage that we've made for participants in this webinar. It's teamfoodsafety.org/forward, and it has a whole bunch of resources for you guys if you want to get started on evaluation, or if you already do it and you want to make your efforts better. We have a list of reliable and valid food safety measures and instruments from RTI International. These are all studies that you can access and download to read more about evaluation, and we have collected many presentations from the Consumer Food Safety Education Conference that talk more about evaluation. So whether you're advanced or just beginning, there's something for you on this page to help you out. Now we will take some questions. So if you guys have questions, go ahead and submit them in your dashboard, and we'll give a few minutes to get some answers. We do have one easy question so far. Yes, we will have a copy of slides, and the webinar is recorded, so that will all be available for you guys to view later. So if you have a question, you'll see a dashboard in the GoToWebinar interface, and that is where you should type it. All right, so here's one that Patricia or Sharmi might be able to answer. Is there concern that scare tactics with food safety will turn off consumers who, if you are a retailer or selling food products? Is that something that you should worry about?
Sorry, can you repeat the question?
Sure. The question is there concern that scare tactics with food safety might turn off consumers if they're, shopping for?
Sure, and I mean, I'm assuming that you're referring to the suggestions for using fear or other emotions included in education messages. And I really think that, or I've seen some encouraging results from other papers that these tactics can work very well with some audiences, but they're definitely not appropriate for the general population or for even everyone. And so I would really encourage anyone who is interested in those types of things to look into that body of research as to who, those types of messages might be most appropriate for, because they're definitely not for everyone.
Yeah, and this is Sharmi, and I'll just add that, scare tactics have been used in certain public health topics. I mean, I'm just thinking of tobacco, and some messages are actually, they really work well, but just like Tricia said, I think some market research and some literature research actually needs to be done before you design something like that.
Thank you, guys. Here's another question for Dr. Baruso. Does your research have international applications?
I actually don't know much about that. Like I said, I kind of confined my literature review to countries that I thought were pretty similar to the United States, just because that seemed what was most appropriate. But I think that thinking more broadly to that, to countries that aren't maybe similar to the United States, that there's a lot more complex, I guess is the right word, food safety issues. Like in some countries, the number of people who even own a refrigerator is pretty low. And so I think that when you're dealing with that, you're not really worried about, is your refrigerator cold enough? You're just worried about, do people have a refrigerator? And so I think it might be difficult to apply some of the specifics more broadly, but definitely some of the concepts would apply for sure. Using evaluation and having this approach to designing campaigns would definitely, I think, apply.
Thank you. And Patricia, somebody else wants to know if you'll be conducting any more interviews or if you are all done with that part of the process.
I think that if there's people who would like to volunteer, that I would absolutely be interested in speaking with them. I would love to get more, like a more broad perspective on this project. So yeah, definitely, I would love to hear from them.
This is Sharmi again, and I would like to add, definitely, because Tricia has already interviewed folks from CDC, USDA, and from here, from FDA. But as you all know, we are so far removed from the community level. So if folks who are doing actual health education at the community level would like to talk to Tricia or anybody else, we would definitely welcome that. So please email her and get in touch with her.
Thank you. Another question for Patricia and Sharmi. Do you have any recommendations for what could be done to increase individuals' perception of risk for foodborne illness?
Yes, I think I can't really speak to all of them right now. They'll definitely be part of the final recommendations, but like I said before, the suggestions that I included in the slides were definitely informed by the research. And so
from what I've seen, using, including stories about victims or cases of foodborne illness has been something that's been shown to change people's perceptions of importance or severity of risk. But that's just one example, and it's not appropriate for everyone. And so I would say maybe stay tuned for the final recommendations in that regard.
Thank you. All right, we have one question for Shelley here. The questioner is curious about the statistic in the SurveyMonkey findings that showed K-12 schools are using TV for outreach. Can you elaborate on this at all?
That is a really good question. I found that surprising also. And the person who posed the question indicates that perhaps that was some form of within-school system. That also is my guess. I will look through the raw data to see if any open answers. There was room for them to provide more detail. So that's possible. It could be also that it's being used for more of a training, in more of a training situation for in-school personnel. So one of the difficulties, as you might appreciate, as you try to really dig into consumer education, is that how do you define the consumer? People are being trained in all kinds of settings, and in some cases they're not per se, a worker in a processing plant, but they are getting some form of training or introduction to food safety in a role as even in some cases volunteer. So I think that's a good theory, that it could be inter-school, and it could also be something that is training.
And we have another question, I think for Shelley. This person says, September is Food Safety Month. Are there any PSAs in grocery stores for consumers?
Well, that's a great question, because this year there's some terrific new PSAs that have been produced by the federal agencies for the Ad Council, through the Ad Council. We sent an e-card to backfighters about this just about, I think, a week ago. I would strongly urge any educators on the phone who are planning now for Food Safety Education Month, which is also great to hear that you're planning in advance, to look at the Ad Council Food Safe Families campaign and take these PSAs to your local media or to your local grocers and ask them to run them. I think you'll enjoy that. They're great pieces.
All right, that looks like about all the questions we have time for today. So thank you all for joining. We ask you to please stay in touch. Follow us on social media. Handle Fight Back. Facebook is also Fight Back. We have a Pinterest page now too. And if you are not already getting our emails, go to fightback.org to sign up for those. If you have any direct questions about pretty much anything partnership related, feel free to contact me, Ashley Bell, at ashley@fightback.org. Thank you again for joining, and have a great rest of your day.
Stand by for your survey, and please take it. Thank you so much.